Hello, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I want to share information with you about an exciting new blood pressure medication which has a unique way of working. It's called Losartan or Cozaar, and it's identified as an Angiotensin II receptor blocker. This medication works by blocking the action of Angiotensin II, a chemical which produces spasms in the veins and arteries of the body. By blocking artery and vein spasms, Losartan or Cozaar reduces the resistance to blood flow in the body. This lowers blood pressure without reducing the amount of blood pumped by the heart. Since Losartan or Cozaar does not reduce the amount of blood pumped by the heart, it does not make people feel tired or weak. This is a major advantage with the medication. Losartan or Cozaar works in a very similar manner to the ACE inhibitors. However, Cozaar does not cause cough, which is a major advantage over the ACE inhibitors. Losartan or Cozaar is very well tolerated in patients and has very few side effects. In several studies involving over 3,000 patients with high blood pressure, half were given Cozaar while the other half were given a placebo. A placebo is a pill which looks like a real medicine but is made of cornstarch. Over a 6-month period of time, 2.3% of the patients who were given Cozaar stopped the medication due to side effects, while 3.7% of the patients who received the placebo stopped the placebo due to side effects. From this we know that most patients can't even tell they're taking Cozaar. Approximately 70% of patients with uncomplicated high blood pressure will have adequate control of their blood pressure by taking 50 milligrams of Cozaar once a day. Hyzaar is a pill which contains 50 milligrams of Cozaar and 12.5 milligrams of HCTZ, a proven diuretic or water pill. If Cozaar does not adequately reduce blood pressure, then Hyzaar, 1 pill per day, should be used. Approximately 90% of patients with high blood pressure will have adequate control with Hyzaar, 1 pill per day. Typically, blood pressure falls very gradually over a 4-week period of time with Cozaar and Hyzaar. We therefore recommend that blood pressure be checked 3 to 4 weeks after starting Cozaar and Hyzaar to be certain that the medication has had enough time to work. On average, Cozaar will lower the systolic blood pressure 6 to 11 points, and Hyzaar will lower the systolic blood pressure 16 points. Perhaps the most important feature of Cozaar is that it has been proven to reduce the risk of death. This was demonstrated very conclusively in the ELITE study, in which they took 700 patients with mild hypertension and congestive heart failure. Half were given the ACE inhibitor captopril, 50 milligrams 3 times a day, while the other half were given Losartan or Cozaar, 50 milligrams once a day. After 1 year, the death rate from all causes was reduced by a factor of 2 in the patients who received Cozaar compared with captopril. What makes this study so powerful is that captopril has been proven in many other studies to reduce the risk of dying from all causes by 20 to 25% in patients with heart disease. Hence, the additional improvement in risk of death from Losartan or Cozaar compared with captopril is very remarkable. Losartan or Cozaar has also been proven to protect the kidneys in patients with diabetes. Cozaar substantially reduces the amount of protein filtered by the kidneys. Reducing the amount of protein filtered by the kidneys reduces the risk of developing kidney failure. The only rare side effect of Cozaar and Hyzaar is an alteration in kidney function and potassium level. This occurs in less than 1 person in 200. For this reason, we routinely recommend that patients have a blood test for kidney function and potassium level 1 week after starting Cozaar or Hyzaar. If the kidney or potassium levels become abnormal, simply stopping the medication will ordinarily return the levels to their previous levels. In summary, Losartan or Cozaar is an exciting new medication which reduces spasms in the veins and arteries of the body. There are many advantages to Losartan or Cozaar. First, since Cozaar lowers the resistance to blood flow and reduces blood pressure without reducing the flow of blood out of the heart, it does not make people feel tired and weak. Second, Cozaar is very effective. 1 pill per day will adequately control blood pressure in 70% of patients with simple high blood pressure, and Hyzaar, a pill which combines Cozaar and the water pill HCTZ, will adequately control blood pressure in 90% of patients. Third, Cozaar has very few side effects and most people can't tell that they are taking it. Fourth, Cozaar is very convenient and only needs to be taken once a day. Fifth, Cozaar has been proven to reduce the risk of death in patients with mild hypertension and congestive heart failure. Sixth, Cozaar has been proven to reduce the risk of developing kidney failure in patients with diabetes. A blood test should be performed 1 to 2 weeks after starting Cozaar or Hyzaar to check kidney function and potassium level. This will ensure the safety of the medication. I hope this educational video has helped you better understand the effects of blood pressure on the quality of your life and the benefits this new medication has to offer.